Hi, everybody. This is Dr. Darren Mills with Freedom Whole Health again. And today our topic is going to be on chelating heavy metals out of the body. There are roughly, well, there's probably more than this, but the ones that I've learned of that can chelate heavy metals out of the body are a substance called EDTA and porphyryme from Biotics Research I've used, and I'll kind of share a little bit about that's the only one I have experience with, and I have had some success with that one. Um, and then the other one is chlorella, and all of those will chelate heavy metals out of the body. Now, what is an example of heavy metals that could be in the body? Examples could be copper, lead, arsenic, mercury. Those are some that come to mind. There's more than that. Cadmium, I think, is another one. Um, but one that people don't often think about is calcium buildup in the veins and arteries, and that is a metal, and it causes atherosclerosis, and that can be life-threatening for sure. So to be able to get that out of there is wonderful. So I'll first give you the definition of chelate. And chelate is Greek. It's Greek for claw. And so basically that's what a chelator does. It envelops uh, a heavy metal, and then it once it envelops that, then that can be removed from the body. But for whatever reason, a heavy metal gets lodged in tissues, and without something to grab a hold of it and pull it out of the body, it'll never get out. It'll just stay in there. So that's why it's important to have something called the chelator to help. I want to give you a quick, the long term for EDTA. That's a big one. I have a friend who uses that and swears by it. I've got to read this and I'm going to read it real slow. It is ethyl tetracetic acid. That's the best I got. Um, so for those of you who want to look up the long term, there you go. Um, so yeah, I think I've covered, I will read what chelation therapy is. It's the introduction of certain substances into the body so they will remove heavy metals, also used to reduce or remove calcium-based plaque. We talked about that from the linings of blood vessels, easing the flow of blood vessels to vital organs and tissues. So the research I had looked at, there was a story of a runner, and he ran marathons, and at the end of his last marathon, he collapsed and got taken to the hospital, and he had I can't remember the exact percentage, but it was like a 80%, not to 90% blockage. And he actually died. He was pronounced dead for 2 minutes, and they were able to revive him, and he had heard about EDTA and got on that product for about a year and went back. And he elected not to have surgery to put a stent in and those types of things. Um, so anyhow, after a year, he went back and he had almost zero blockage. I can only tell you what the research said that I looked at, and I'll give you the resource at the end. Now I'll do a quick commercial. If you like what I'm doing and you get some benefit from the education that I provide, please use my services. Please tell other people about my videos so that they can see it and maybe use my services. You can buy supplements from me. You can get on my website and it's called eStore.com, and you can, I mean, it's called eStoreX, I'm sorry. But you do that through my website, and it gives me credit for that. You can order other supplements just by calling in. So anyway, that's my commercial. Thank you for just coming to see what I have to say and for sharing this information. So, the effects of these supplements, EDTA, chlorella, and porphyrozyme, all have the same kind of effect because they are cleaning the arteries out, and that's going to help your brain because there's calcifications that get into your brain. And someone yesterday asked, "Is that considered even with your pituitary?" And I suspect it would be. And your pituitary is known to become calcified at certain times. So I suspect that could help with that um, greatly. And people that have plaque built up in the veins going to their brain certainly would be feasible that it would if that became unclogged would help their cognitive function. Um, Nerve endings can come back to life, so people with neuropathy can greatly help their neuropathy by taking EDTA or chlorella or porphyrozyme. Inflamed joints are soothed. And that makes sense to me too, because again, nerves that become impinged because of calcifications, um, and it's a lack of blood flow, can can uh, can greatly be helped. Organs are revitalized, and that includes the men's love organ. So that can be greatly helped. Skin is strengthened. It can help lower blood pressure and it can help lower cholesterol. Again, because the heart has to pump uh, less hard because it's not having to pump through a calcium buildup in the veins. And I wanted to say this too, the American Heart Association recommends EDTA be used intravenously in large doses for people who have had toxic heavy metal poisoning, such as lead poisoning or arsenic poisoning. It is, according to the American Heart Association, uh, it is safe to use and very effective to use, um, you know, for helping people get heavy metals out of their system quickly. So and now we're talking about massive doses. It would help edema because again, it's going to be helping your veins get unclogged and chest pain. People with chest pain would be a good idea to use EDTA. Um, so again, you'd have to check with your medical doctor. I will have a disclaimer here. If you're, I don't know how EDTA works with what you're already doing. If you've taken, certain blood pressure medication, I suspect it would be fine. But again, I'm not a medical doctor, so you'd want to probably speak to them about that. Uh, Oral EDTA is um, shown to be 82% effective in dissolving plaque that blocks arteries. So that's that's pretty effective. That works good. I do want to mention that EDTA and all of the chelators I'm talking about chelate all minerals and metals out of your body. So it's important to put the good ones back in, and that is so there's a multi-mineral supplement you can take at the same time you're taking EDTA or chlorella or porphyrozyme, and it will help you not lose. So for instance, you wouldn't want to lose calcium out of your bones, uh, that kind of thing. Um, One thing to note is you must be patient because it can take a year or longer to see a huge effect. And I did want to tell you that I use porphyrozyme with a gentleman for a couple of months. He was a massage client, and he had a blockage in his heart, and he went back after a couple of months, and had been improved. Now, I don't know what else was said to him, but he elected not to keep buying more porphyrozyme, which I was shocked by. Uh, but I think from my recollection, it was like a 30%. Uh, he was 30% better than what he was when he first started. And that's with, I think he only bought like 2 or 3 bottles at the most. So anyway, I can give a testimonial to porphyrozyme, and it seemed to help him a lot. But these things can take time. The longer that the plaque has been built up in there, the longer it's going to take. Um, my resource that I used was easyhealthoptions.com/EDTA. Again, that's easyhealthoptions.com/EDTA. So you can do a little more research if you'd like on that. And I appreciate all of your time. Um, Appreciate you supporting me. And that's going to be it. I just wanted to do a quick few minutes to do a health topic. And I do that, try to do one every other week. So you can join me on Zoom. Again, you can just email me at drmillsnd@freedomwholehealth.com. Give me your email and I'll put you on my email list. Thank you all so much. I'm grateful for each and every one of you.